Hi everyone, my name is Radeesa. I'm a medical student at the University of Pittsburgh, and today I'll be discussing prenatal diagnosis of Pierre-Robin sequence using ultrasound. PRS is defined as micrognathia and glossoptosis leading to upper airway obstruction and respiratory distress, as shown with this illustration on the right. Prenatal diagnosis of PRS is key in preparing the delivery team for an airway emergency. However, as of now, PRS has always been diagnosed postnatally. The 20-week anatomy ultrasound provides anatomical measurements. However, none of these measurements include anything for micrognathia. On the right, you can see a typical mid-sagittal plane ultrasound image. I'd just like to point out two different landmarks. Here you have the maxilla, and here you have the mandible. These are the two main landmarks we use to measure our parameters. For our methods, we did a retrospective review of 80 patients who were born between 2014 and 2018 in Magee Women's Hospital of UPMC. We did a chart review to look for respiratory and surgical interventions that were administered postnatally, and then scored them for severity using the guidelines you can see on the right. Then we went into the mom's charts and found that, unfortunately, half of our patients did not have ultrasound images from their 20-week anatomy visit. However, of the remaining 40 that we did have, we were able to measure for three different parameters. First, we have FMA, or facial maxillary angle, as you can see on the right, and anything less than 66 degrees we considered micrognathic. Next, we have FNMA, or facial nasal-mental angle. Anything less than 136 degrees was micrognathic. And last but not least, a novel measurement, alveolar overjet, which you can see on the right is the yellow line, and then the blue line is representative of the Frankfurt horizontal. Our results showed that as patients required any sort of respiratory intervention at delivery, they had a tendency to have a more acute or more micrognathic FMA. Furthermore, as they required more severe surgical intervention, they had a more acute FNMA. As they required more surgical intervention, they also had a tendency to have a larger or wider alveolar overjet. And as the severity of respiratory intervention increased, they also, same thing, had a tendency to have a wider alveolar overjet. Unfortunately, however, none of these results were significant, but there was a trend that we noticed. So to conclude, one, it is possible to quantify the maxillomandibular relationship on prenatal ultrasound. Two, while almost half of our patients at this gestational age had normal FMA, the majority had abnormally acute FNMA. And three, alveolar overjet, previously not described in prenatal ultrasound literature, is measurable, and it may have utility in prenatal diagnosis and severity prediction of PRS. We have exciting research coming in the works still. We're hoping to do a comparative analysis, a case control study, so that we can compare the patients that we have so far to a normal group and see if it's possible to diagnose PRS prenatally instead of just scoring for the severity. Thank you so much, and stay safe out there.